Hello everyone, my name is Xiandi Wang from the Medical Simulation Center, West China Hospital, Strain University in China. It is my great pleasure to share with you our recent works entitled RDG Uses, a real-time dynamic and generalizable ultrasound simulation system for musculoskeletal minimally invasive training. Ultrasound-guided musculoskeletal interventions such as spinal injection and nerve blocks are increasingly important in orthopedic and pain management. Compared with blind or X-ray guided procedure, ultrasound offers real-time visualization, great flexibility, and no radiation exposure. However, these benefits come at the cost of the steep learning curve. Clinicians must master accurate needle placement, develop strong three-dimensional spatial reasoning, and handling the ultrasound probe with great precision. This makes the training both challenging and time-consuming, highlighting the need for advanced simulation system. Existing approaches unfortunately fall short. Physical-based simulation can capture acoustic principles, but often fail to reproduce the complex visual style and artifact seen in real clinical ultrasound. On the other hand, deep learning-based methods typically rely on static, fixed plane images and struggle to deliver the dynamic and the real-time performance required for effective training. To overcome these limitations, we propose the RDG uses framework, short for real-time dynamic and generalizable ultrasound simulation. Our work introduces innovations at three levels. First, the data. We designed a special constrained acquisition pipeline to collect paired CT and ultrasound dataset from real human subjects. This ensures anatomical alignments and provide a high-quality fundamental for supervised training. Second, the algorithm RDG uses employs a two-step simulation strategy. In stage 1, we use CT segmentation and the convolutional recasting algorithm to generate B-mode ultrasound images that reflect the acoustic property of tissues. In stage 2, we apply a cycle-GAN enhanced with structural similarity loss, which translate the simulated images into realistic ultrasound style while preserving fine anatomic details. By combining physical modeling with generative translation, we achieve both structural fidelity and visual realism. Third, the system. We embedded RDG uses into a multimodal training platform. This platform integrates X-ray, CT, ultrasound, and anatomical views, enabling trainees to practice not only ultrasound-guided procedure, but also to develop cross-model spatial reasoning skills, which is a crucial ability in clinical practice. We evaluated RDG uses on a dataset of over 11,000 paired CT ultrasound scans from real subjects. Compared with baseline methods such as PIX2PIX and the diffusion model, our approach achieved superior performance, reaching a SSM score of 0.844, the highest among all tested methods. In expert reviews, our system received strong feedback, particularly for anatomical consistency and usability. What is especially important is that during inference, we employed the CT image series from the Visible Human project. This is a publicly available anatomically complete dataset of male and female cadavers captured at 1 milliliter actual interval with 512 by 512 resolution and 12 byte grayscale depth. Using this dataset, RDG uses successfully generated realistic ultrasound images, maintained real-time performance, and demonstrated strong generalization to previous unseen anatomical inputs. This confirms its robustness and potential for prospective training application. In summary, RDG uses is a real-time, dynamic, and generalizable ultrasound simulation framework. It is trained on a paired data from real human, validated on visible human CT inputs, and deployed within the multimodal training system that fosters cross-model training. Together, these elements make it a powerful tool for improving both the realism and the effectiveness of musculoskeletal minimally invasive procedure training. Looking forward, we plan to extend our work to more anatomical regions and multi-center datasets to deploy the system at scale in clinical training program and to explore advanced generative model for even greater realism and robustness. Thank you very much for your attention. I sincerely look forward to your questions and discussion. Thank you.